plenty to talk about with my next guest, Northern Ireland Secretary Brandon Lewis, who joins us now. Good morning to you.
Good morning.
Good morning. Obviously, we're heading into a bank holiday weekend. Lots of concern about what's happened on Wednesday. People out on the beaches enjoying themselves. Are you in government fearful of a second spike?
Well, everything we're doing is to focus on ensuring we do everything we can to avoid having a second spike, and it's absolutely key for our economy and for the health of people across the United Kingdom. From what I'm hearing this morning on the weather, we may not have as nice a weather this bank holiday weekend as we might all like. But look, what we have seen, I think, over the last few weeks, and even in the last bank holiday weekend and last weekend, is the far majority of people across the country have used their own good common sense. They follow the guidelines, and that's why that R level is coming down.
Okay, well, let's talk about what will hopefully be game changers in terms of us coming out of lockdown completely and not just enjoying ourselves on a sunny beach. But this rollout of 10 million antibody tests next week, first up to NHS staff and carers, with just a finger prick test, and also the possibility of these antigen tests that could take just 20 minutes after as well. This will make a massive difference to how we are living our lives, finding out who's got the virus, who's had the virus, and who needs to quarantine and who doesn't. How soon can these be rolled out across the country? Because it's all very well, obviously NHS staff and carers should be a priority, but 10 million, well, you don't need 10 million for just NHS staff. How soon could you promise that we could all get access to an antibody test and find out whether or not we do perhaps have immunity?
Well, look, you're absolutely right. This is a large, an important part of the work we're doing in terms of keeping our level down and giving people confidence and understanding. One of the big things this will do is add to our understanding of who has had the virus and therefore where it's been spreading and how it's been spreading, which is important. Look, as the Health Secretary himself said, we do want to roll this out more widely. We have ordered that 10 million plus test. We're going to start doing tens of thousands a day very, very soon, in the next week or so, which means we should be able to move that out to the public fairly soon. I'm afraid I can't give you a date yet about exactly that when that will be, because I think understandably and quite rightly, the Health Service want to ensure that we get the frontline health and care workers dealt with first, and then we can start looking at how we move that out to the public. But yes, obviously with 10 million plus coming through, there's plenty of tests to be able to go around, and they'll obviously be adding to that as we go forward to ensure we get as many people tested as we can.
Okay, now the government's announcing today this 14-day quarantine for all arrivals from abroad. That, of course, includes those Brits who are returning from holiday. If and when we do get to go on holiday, police are going to be checking up on people. Are they at the home they've said they'll be at, for £1,000 fines if they don't obey. If, however, we have an antibody test to show if someone has had the virus or not, and whether or not they're no longer a risk to themselves or others, and an antigen test we can find out within 20 minutes, why would we need to quarantine people coming into this country?
Well, as you said, I mean, I don't want to get too far ahead of ourselves. The Home Secretary will be doing the press conference later on today and will outline the details of what we're going to do with the quarantine scheme as people come into the UK. Look, you're quite right. What we're saying is people are coming to the United Kingdom, UK citizens and from elsewhere. We've got the R level now down very low. So people coming in, if they have this virus, have the ability to impact that in that marginal way, in a much, much heavier way. So we've got to make sure we're doing what we can to protect people. So the quarantine is the right and logical thing to do. And I think people will understand that. As we go forward, what we're doing, this is why these things are always kept under review. We're continually updating what we're doing as we learn more about the virus, as we've got more capacity, as we did with the first stage of testing, obviously the health service first, and we've been able to widen it out to more people. The same with the antibody tests. But right now, the best way for us to keep that R level down is to ensure we do all we can to prevent people coming and pushing that R level up by spreading the virus. And the best way to do that is if people are coming into the country, but they take the precaution of being in quarantine, because when they first come in, they could have the virus and be asymptomatic and not know it. And therefore, the current test wouldn't highlight that necessarily. So I think it's the safest and most sensible thing to do. And I think most people will recognise that and appreciate this is all part of just trying to protect the health of people across the United Kingdom.
Well, we've just been discussing with Lord Digby Jones about why the quarantine is being brought in, at the beginning of June, why it wasn't brought in when many other countries were bringing in those sort of quarantine measures. Australia, many countries across the EU. Can you explain to us just once again why on earth we didn't have quarantine rules for people coming to this country, including Brits coming back from where they've been living or on holiday abroad during the time when this epidemic was at its peak, and why bringing it in now when we know that around the world, certainly the countries that we'll be able to fly to and from, it's actually on the wane.
Yes, look, and I can understand why people would be curious as why we're doing this at this point. And it's, as I said, all the way through, we've been guided by the science. And what the difference between now and some time ago, apart from wanting to make sure that we got UK citizens home and the chance of them to come home, and of course, don't forget where we've been in lockdown, people coming home would have been going into staying at home and therefore that isolation anyway as UK citizens. But also it's this issue around that marginality of the impact something has. Where the R level is now so low, and we want to get it obviously as close to zero as possible, one person coming in and spreading the virus can have a big impact. And therefore, as the number of people coming to the United Kingdom now has fallen to a much lower level as well in terms of the amount of flights coming in, obviously, that can have a much bigger margin impact. So now we think is the right time to look at doing this. But as I say, more details of this will be outlined just a bit later on today.
Okay, yes, this is the trouble. We're often talking about news that's going to be outlined later today and can't get any more detail. What about the prospect of immunity certificates on the front page of the Times? There's some sort of form, basically, if you've had coronavirus, you've got the antibodies, and you could have some certificate. I'm not sure a certificate would work. I think you're more looking at, say, wristbands or something that can't be, passed on to someone else, but to show that you are safe and helping to ease the lockdown, because it surely is in everyone's interest, whether you are the most vulnerable person having to self-isolate until there's a vaccine, or if you are or someone on a furlough scheme right now, but it's in everyone's interest to get as many people out and about working, maybe even being able to open up some restaurants and bars for people who've got those immunity certificates. That would be a good thing for the economy, surely.
Well, I think I understand your point about the wristbands. I'm sure nobody listening to the show now will know of any young people who've been to a concert or an event and passed their wristbands around. So I fully appreciate that.
No,
point.
the ones you can't get off, like the hospital wristbands.
Yeah, no,
the ones that you can only get off if you break them.
I do appreciate the point you're making, Julia. Look, I think on a serious note, I think first of all, we've got to get these antibody tests moving out there. We've got to understand more about how long any antibodies give you immunity for, what level of immunity, before we can really start looking at something like that being something that would be practical, helpful, useful, and fair and accurate. So I think we get a bit ahead of ourselves in terms of that kind of a product at the moment. But as I say, we keep these things under review. And one of the challenges of the new virus is as we learn more about it, as we move further on in the curve and downwards in that curve, as we have been doing for the last few weeks, then obviously we can look at what more we can do as we come out of come out of lockdown, and do so in a way that works for people's health as well as for our economy.
Okay, let's talk about this U-turn from Boris Johnson yesterday. On Wednesday, he was happily defending the NHS migrant workers surcharge, £400 a year, going up to over £600 in October for each person and every member of their family in the country. He's defending it and saying we needed the £900 million it raises for the NHS. Yesterday, Matt Hancock at the press conference announced a U-turn on that. If the policy was a good policy that could be defended, why hasn't the Prime Minister continued to defend it? And if it wasn't a good policy in the first place, why was it ever the law?
Well, I think there's a few points in there. And I think the Prime Minister himself outlined, if you look back to what he said on Wednesday, that this is something he has been thinking about. I think, first of all, for the policy more generally, the fact that people come into this country pay that surcharge, I have to say I've always been quite comfortable defending it, and I'll defend it here with you right now on the basis that all of us who are UK citizens throughout our working life are paying our bit into the NHS with every pay packet that we get. That it means that the NHS is there at the point of delivery when any of us need it at any time. When people come into the country, as migrants, they come in and often are here for a fixed period of time. They're not contributing over a long period of time. So then putting that surcharge in is about them paying their fair share towards the health service. So I think that's a legitimate and a correct thing to do. And as you say, it was going to raise about and will raise close to £1 billion over 4 years.
So why stop it for NHS workers?
For the health, but I think what the Prime Minister... The reason he's been looking at this, and as he said on Wednesday, think about it, made a decision yesterday, and I think understandably, is what's been made very clear in just the last few weeks, the last couple of months as we've gone through this virus, is the NHS workers are contributing to the NHS by being in the NHS. And
they're doing their job, but they're being paid to do their job.
They are. They're doing their job.
And we know from the statistics they're at no greater risk of getting the virus than anyone else in any other job. Frontline NHS workers have no greater risk than those working in the back room or those working in any other job who's out at work. Why exempt healthcare workers but not all the other migrant workers then? It doesn't make any sense. Other than gesture politics. Well, we don't need gesture politics at this time. We're in the middle of a pandemic.
No, and I think first of all, I think it is right. I think we should be very upfront about the fact people sometimes, you in opening this public conversation talked about U-turns. Actually, I think it is right that government is able to look at something and say, actually, in the current climate, with the information we've now got, we're going to make a decision that may be different to one we may so a while ago, because things change. And I think with the health service, the reality is people working in the health service are contributing to the health service in the work that they are doing in it by coming here to be part of it. And our health service has relied in areas of it for a very long time for people from overseas. And I think the Prime Minister's point is that...
But what about supermarket? What about a migrant worker who's come and who's working in the supermarket and is making sure that we've got food on our shelves? That's keeping us alive as well. Why don't you end the surcharge for them as well? Why just NHS workers? I understand the great work that people in the NHS do, but lots of other people do also do great work that helps us.
Oh, look, absolutely. There's people from all over the world who have played a huge part in our country, in our economy, in our communities, our society. Absolutely right. The difference is those who are working in the health service, it's that positive circle. They're coming into our health service to support and help our health service where we need them. That we've seen in the last few months the heroic work that all of those in the health sector have done. And I think it is right. We say thank you to them and recognise that they are part of the health service. So everybody else, all of us fund that health service in our taxes every day. Other migrants coming and working in other sectors pay into the health service so that it's there when they want to use it. What we're saying is for the health workers who are working in the health service, we recognise that they're contributing that extra bit by being in it in the first place.
All right. Thank you very much for joining us, Cabinet Minister Brandon Lewis. Very much appreciate the Shadow Secretary of State for Health, Jonathan Ashworth, who joins us now. Good morning to you.
Good morning.
Good morning. And before we get to the NHS surcharge, which I'm sure we will want to talk about, lots of good news today. Rollout of 10 million antibody tests from next week for NHS staff and carers first, then the rest of us. An antigen test being trialled that could actually just take 20 minutes after being swabbed for us to know whether or not we are actually carrying the virus right now. Do you think we're on our way out of this pandemic?
Well, these are both really important developments because testing really is the key to easing lockdown, testing backed up with what we call contact tracing. But if we have a test to see whether we've had the virus and whether we've got the antibodies circulating in our body, I think that's a crucial development, although we have to be cautious, of course, because we are assuming that if you've had the virus, you've built up a degree of immunity to it in the future. That is not 100% certain, but it's a kind of an assumption, which is probably a reasonable assumption to make at this stage, although we'll have to keep it under review. But the other test that you talk about, the antigen test, that's the test to find out whether you've got it. That's what a lot of the testing that is going on at the moment is all about. If we can make that test quicker, we can roll out more of it, because I believe we need to be testing everybody in a care home, whether they've got symptoms or not. We should be testing every NHS worker, whether they've got symptoms or not, because we now know there's a huge degree of asymptomatic transmission. In other words, people who don't realise they've got it because they're not feeling poorly actually do have it, and they're transmitting the virus. So if we can have mass testing of people in key parts of the public services, care homes, hospitals, etc., that is absolutely crucial.
And we've seen, obviously, these random antibody tests that 17% of those living in London have had, are believed now to have had the virus. Only 5% of the rest of England. We're a long way, of course, aren't we, from getting to herd immunity. Let's, though, focus on this U-turn by the government yesterday. Boris Johnson on Wednesday was happily defending the NHS migrant surcharge for any workers who come from outside of the EU. And actually, as of the 1st of January next year, there will be all NHS workers from outside and inside the EU who work here, who have to pay £400 a year NHS surcharge. It's going up to £624 in October. Last year, doctors, nurses and paramedics were allowed not to pay that charge. But Sir Keir Starmer said it was untenable for people to be clapping NHS workers on a Thursday and then charging them on the Friday. He's now announced his U-turn for all migrant health workers. Why shouldn't migrant workers in the UK pay a surcharge to use the NHS?
Because, as you know, the NHS has relied on international recruitment throughout its 72-year history, and we should thank the people who come from across the world to come and care for our sick and our elderly here.
Why should we?
Why
should we?
Because they are doing for us a tremendous service.
But Jonathan, with all due respect, do you seriously think someone is sitting in India or in the Philippines and thinking, what I really want to do is go and help the good people of Britain and save their NHS? People come to Britain to make a new life for themselves, to get work that they want to do, and they're paid for it. We've got to stop sort of sanctifying people who are just doing a job. With all due respect, I'm a daughter of an NHS GP. I'm not criticising NHS workers wherever they come from Britain or abroad. But let's stop this idea that people are coming to this country to save our NHS. They're coming here for a job.
Well, they're coming here to work in the greatest health institution in the world, which is the National
Is it
Health
the greatest
Service.
health institution in the world?
Yes, absolutely, no question. I mean, we can be so
Even though,
proud of our national health.
even though we don't have the greatest rates of survival from heart disease or cancer, or indeed it would transpire from coronavirus.
I think the NHS is the best way of delivering healthcare, free at the point of use, paid for by the taxpayer, and it inspires people. So people do want to come and work in our National Health Service. And you are quite right. People come here to start a life, to contribute to society, and they pay their taxes. So and by paying their taxes, they're actually paying for their National Health Service. So I think this is a fair and reasonable thing for Labour to have called for Keir Starmer to have called for it. But Boris Johnson disagreed with Keir Starmer on Wednesday. On Thursday, he changed his mind and he did agree with Keir Starmer. So it's quite a victory for Keir Starmer as well.
Oh, absolutely. There's no doubt. And there's pressure, obviously, from Tory backbenchers. But fundamentally, yeah, Keir Starmer called it a victory for common decency. One of the Tory Select Committee heads, Robert Halfon, said it was an immoral tax. But if it is an immoral tax, you can argue with the Tories they shouldn't have brought it in the first place, if that's the case. But also, should it not be scrapped for all migrant workers?
Well, I actually think our immigration system needs to be looked at properly because it's full of these anomalies. And I actually think that when people come to this country to work here, they're actually paying their taxes, and we're actually penalising people twice. So we actually need a fair system. The government are not putting in place a fair immigration system. They're sort of chasing headlines. I mean, I just think it's a nonsense, for example, that they're saying that care workers are low skilled. We have seen in this crisis how absolutely vital care workers are in our care homes and
but you can be vital and respected and valued and do very, very useful work but still be low skilled. With all due respect, the people who are cleaning the streets right now and emptying the bins are doing a more useful job than either you or I, but it doesn't mean it's skilled work.
But why then is the Priti Patel and the government pushing ahead with an immigration system that penalises a lot of these people? I mean, our social care system is hugely reliant on international work and is already short of 120,000 staff. I mean,
but it's reliant on it because there was a deliberate policy decision for years to import people to do the jobs. We've got plenty of British people. We've got loads of brilliant A-level students with A grades coming out of their ears who aren't allowed to study medicine in British universities because there's a cap on the number of places for British students. And yet we then say we haven't got enough doctors or nurses. Let's import them from overseas.
Don't get me wrong. I want to expand training places. I mean, you are right. The way in which we are training nurses, healthcare workers, doctors, etc. in this country has led to has partly contributed, not wholly, but it's partly contributed to the situation where we have 100,000 vacancies across the NHS. This all needs to be looked at properly and reformed. I totally agree with you. But the problem with care homes is that in many cases, and I've seen this in Leicester, is that when a new Asda's opens up or something like that, we actually see vacancies in care homes go up because people leave social care because they know they can get a better paid job working in a local supermarket. I mean, that is crazy. We need people to care for our elderly and adults with disabilities who are in receipt of social care, yet we're not paying people properly. This all needs to be reformed and looked at again.
Okay, Jonathan Ashworth, always a pleasure to speak to you, sir. Shadow Health Secretary Jonathan Ashworth there. Well, let's talk about all of this with Lord Digby Jones, former Director General of the CBI. Good morning to you, Lord Digby. Lord Jones.
Julia. Good morning,
I like Lord
everybody.
Digby, it sounds better. Good morning. Look, we know that there are all these developments we're getting now, the antibody test, the antigen test, more and more accurate, quicker results. We know that there are some treatments coming through. Obviously, there's lots of work on vaccines. It looks like Oxford University and Imperial College in London are really at the forefront of this. Looking ahead at all of that, whatever happens, we are still at some point going to have to come out of lockdown before it's 100% safe to be out, because that's what life is like. We know the majority of the cabinet are now backing easing the lockdown restrictions even further. Do you think, A, that we should be easing lockdown restrictions and getting people back to work? And B, how do you think it should be done?
I think it's a question of the balance of risk, isn't it? I was quite interested with the teachers' union saying, but Michael Gove has said he can't eliminate risk if we go. They're at risk if they drive their car to school. They're at risk if they go down a set of stairs in their home in the morning. I mean, and it's all a function of the assessment of risk. And I think what the government will be driven by on an official level is this R rate, this famous rate of making sure that when the virus gets into somebody, it doesn't transfer to somebody else, it dies in the person. So basically you get to the point where the community don't have an increase in the numbers of people. And if they carry on seeing those three things, hospitalizations going down, cases going down, hospitalizations going down, and very sadly, they're still there, but going down, deaths. If those three things keep going down, then on official bases, the government will keep releasing lockdown. The problem they have living in a democracy is media and a paid opposition, paid to oppose them and all that. The problem is that words like country has fewer cases today never made good news. Yeah. Country's going to hell in a handbasket made great news. So the problem is that the good news comes out, doesn't even make the headline, whereas the bad news comes out and everybody's screaming. So,
well, indeed, new infections have fallen 40% in the past fortnight. Why that isn't on the front page of every paper today, that shows encouraging news.
You're so right. I mean, I noticed in the week, one of the 5 o'clock briefings, and it was the day when cases had really gone down. And all Nick Watt of the BBC did, he actually went for the jugular of the government on something else. There wasn't a moment of recognition that things are all... And people do listen to it. In democracies, people have that opinion which drives government. So on an official basis, they were relied totally on the statistic to release lockdown. But I think you said something quite interestingly to your guest just then, which was, is it the way the government like it that people are, by and large, in one way or another, disregarding it a bit? And I think, by and large, the British public have been obeying it. Yeah. And you'll get the headline. You'll get the headline of somebody's doing something wrong. But at the end of the day, the greater part of the British people get it, and I think they also get what common sense means. And you did say in the last part of your question to me about, and do you think they should be going back to work? I definitely do, as long as employers can say to the people, whatever their job, I can guarantee to you a safe distance. Not I can guarantee you won't catch it. I think that we come back to the risk point. But I can guarantee to you that you won't you can socially distance by coming to work. If I can't guarantee that to you, I want you to work from home. And I will facilitate the working from home, and that's going to carry on.
Okay, the question is, though, what that safe distance is, isn't it? Because we in this country have the 2-metre rule. That is, in all the government guidance and laws. But most other countries are 1.5 or 1 metres. We were told the other day that actually by medical advisors there isn't any specific medical evidence for it to be 2 metres. You're safer at 2 metres than you are at 1. But if the rule was changed in workplaces to 1 metre, that would enable an awful lot more employers to bring their workers back into work and perhaps keep their businesses afloat.
Yeah, but I think the problem is that if you go around your supermarket, if you go walking on the street, and I guess if you go to most workplaces, 6 feet is becoming 4 feet or 3 feet at most occasions. I don't mean the official put the tape on the floor, distance the seat, distance the desk. I don't mean that. But walking around and doing stuff, I bet you it's nearer 3 feet most times.
And I've always thought that's why they made the 2-metre rule, is that people will mess up the 2-metre rule and then they'll stay within 1 metre.
I agree with you totally. I reckon put it at 6, we know they'll do 3. If you put it at 3, they might not do it at all. So I think that is all right. But the big issue, the really big issue, and this is a London issue more than anybody else, but to be fair to Manchester, Birmingham, Liverpool, Newcastle, Cardiff, Belfast, you've got and I mustn't forget, Edinburgh. To be fair, it's the public transport issue. There is a real problem with getting people to work in the major cities, which, let's face it, is where the major infections have taken place for obvious reasons. There is a real issue in getting them to work because not everybody can't go on a bike and everybody can't drive in their car. And we have
most people don't use public transport to get to work, and certainly outside London they don't.
No, I agree. The majority on statistics, you're probably right. But in terms of getting a lot of people to work, mass transit, it is public transport. I have to wonder what on earth we have a mayor in London doing on the week that the government is rightly saying, can you think of ways of coming to work, please, that don't involve public transport? And he goes and puts up the congestion charge for motor cars. It is beyond belief what some people will do to hurt a government in a crisis. But nevertheless, there is an issue with public transport. Now, if they can somehow get people, the mass transit issue sorted, I think we'll have a country in shorter order than we think that get people back to work. But then the last point is, of course, the one you were just playing the clip in the news of O'Leary and his issue, which is an issue, if anybody ran an airline, they'd say the same thing, which is this point of coming to the country, 14 days self-isolation. I have no idea why this government did not bring that in some 2 months ago. I've got no idea why not, because frankly,
well, they said why not. They said there was simply no point in quarantining people. There were the only tiny number of people flying into the country. Virtually all of them were British people returning, being expatriated from abroad, but repatriated, from abroad. But also that they were coming from countries with no higher rate of coronavirus than we already had in the country at large.
Agreed, but they might still have got it. They might still have had it. I mean, it's not. This is not a. From
the argument was, I'm not defending the government on this. I'm saying that repeatedly the chief medical officer and the chief scientific advisor said the reason why we're not having the quarantine was because there's no point. It's already here. It's already across the country. We can't contain it. It's already here. So there's no point. The few thousand people who are flying into the country who are British anyway of quarantining them. It won't make any difference. Was the argument.
Well, and I don't agree with them. I actually believe that if you've got one more person coming in who got it, then that's one person who can make it 2, 4, 16, 32 quite quickly. And we were doing everything we could to stop one person in their own home in Netherwallop passing it on. So why didn't we stop that? But now we're going to do it. But then I think it is right that, and isn't it interesting, in this time of crisis, the innovation and the invention and this tremendous research that goes on really, really quickly to respond. And well done. And it's the same in wartime, isn't it? So many things get invented and thought about at times when you have to. And so looking at dealing with that issue 8 weeks ago, it was very clumsy way of 14 days at home and what do we do about policing it. Now, it looks like, a bit more science maybe, but it looks like you can get a result in 20 minutes. So in you come at Heathrow, it's going to that room, please. 20 minutes later, you're on the plane back, or you're in quarantine, or you're free to go completely because we've got the result of a test. And that couldn't have happened 8 weeks ago. It hadn't been developed, but it has now. And I think that would actually probably solve it for everybody because surely the airlines would be happy because they could have people still flying, and I'd be happy, and I hope millions of others, because we would know that people coming into our country hadn't got it.